Thanks, Aditi. Thank you all for inviting me to be part of this conversation. I'm delighted to have the opportunity to talk with you and excited for the conversation on this panel. I'm going to start just by sharing my screen so I can share a few slides about some of the work that we do. As Aditi said, I sort of play two roles here. I direct an institute at Johns Hopkins University called the Stavros Niarchos Foundation Agora Institute that's dedicated to strengthening democratic institutions with a particular focus on civil society organizations. And I also direct a research lab called the P3 Lab. And we call it the P3 Lab because we're dedicated to trying to understand how you make the participation of ordinary people possible, powerful, and probable. And so I come at this work from both of those perspectives, where we're trying to understand how we can use the resources of the university and of scholarship to help strengthen work of organizers in the field to better promote community power building and health equity. What I did learn, not because anyone told me it, but because it was just such a part of who we were, was this idea that transformation is a fundamental part of who we are as humans. Right. And it's not only possible, but it's a way of life, right? That what we do as immigrants, as people, is we try to remake ourselves, to remake our families, to remake the world around us. And that's what I saw my parents trying to do. And so I think that was what really drew me into politics originally when I first went to college. And I ended up working in electoral politics for a while after college, because I thought that's where I was going to be able to continue on this pathway of transformation that went beyond my family. But as I got involved in electoral politics, I think really quickly, one of the first lessons that I learned is that policy is downstream from power, right? So what drew me into politics was because I wanted to work on issues like health equity, education justice, sort of different things that I felt were really pivotal in the experiences that I had had growing up as a kid in Texas. But when I went to go work in those domains in the political system, what I realized is that all of that is downstream from this question of power. And so really what I began to think about is this question of, well, so then how do we support a variety of different groups in being able to exercise power over the outcomes that they care most about in their own lives? And so that's why we sort of got into this work. And the way that we think about, and when I say we, I mean sort of my research lab and people that I work with, the way that we think about power really has to do with this notion that starts with the notion of sort of what people's theory of change is. And so there are different kind of social problems out there, and different problems require different solutions, right? So when polio was a widespread problem, we needed a polio vaccine, right? Some people might argue that things like a tax credit could help affect, change incentives around the extent to which we, use carbon or emit carbon into the air. So there are all these different kind of problems where different sort of problems will lead to different kind of solutions. And problems of power, I argue, are most important when the motivation to make the change and the authority to make it are not aligned. Right. So the idea is that you have a problem of power when the people who most need the change, right, often the frontline communities, don't have the authority to make the change, or conversely or relatedly, when the people who have the authority to make the change aren't motivated to make it. And so, an example that I use commonly from health equity is that from health issues is that when doctors used to tell parents to put their babies to sleep on their stomachs because they thought that was better for babies, but then they realized it's much better for a baby's health, obviously, if you actually put them to sleep on their backs. And so they had this whole campaign, Back to Sleep, right? And that reduced rates of SIDS a lot over time. But the reason that worked was because the people who had to make the change had the authority and the motivation to make it, right? That when doctors gave them the information about the change that they needed, parents are, of course, highly motivated to do what's right for their children, and they had the authority to do so. So they were able to make that change. But our stickiest social problems, the ones that have to do with equity, are problems of power because often that alignment isn't there. And so in those kind of situations, what you have is a situation where simply giving people information, creating a new technology, or streamlining incentives isn't going to solve the problem, but instead you have to figure out how people can act and how they can act together. And so a lot of the work that we've done in P3 and also in Agora has been trying to figure out how do we strengthen the ways in which people are able to act together. And so in thinking about this question of how we support community groups, I'll focus on some of the work that we've done in P3. And in that domain, a lot of the groups that we work with are listed on the side of the slide here. So we work with organizations like the Amos Project, Lucha in Arizona, New Virginia Majority in Virginia, or Isaiah in Minnesota. A lot of these are part of statewide independent political power organizations, where they're multi-issue organizations that are organized around particular constituencies whose voices they're trying to elevate and build power for in the political system. And the work that we're doing as researchers is we try to partner with them in a way that helps sharpen their practice. So at the first level, what we're trying to say is that we're not simply evaluators, right? We're not just going in and evaluating their program, but instead we're trying to think about what are the questions that are at the forefront of their strategic dilemmas. What are the questions that are keeping their organizers up at night? And then how can we put learning systems around that we create together with them so that we can sharpen the practice both of the organizers and inform our general understanding of the way in which community power might relate to things like health equity. So that's sort of one thing. Second is, as researchers, another role that we feel like we can play is we can help make visible the work that they're doing in ways that enable learning, right? And so, there are some examples on the slide of some graphs that we did where we sort of mapped the kind of power networks within which these organizations are working, or we graph the ways in which they've been building constituency over time. And part of what that does is make visible both for the organizers themselves where they're able to build constituency, where they're not, where they stand in the power networks within which they work, but then also to sharpen our broader understanding of the role that these community power groups play in this ecosystem that Aditi was describing. And finally, in all of this work, we're constantly trying to push the boundaries of strategic thinking, as I said. And the only thing I would add to that is that we want to push the boundaries of strategic thinking, not only among the community power groups themselves, but also among researchers. And the reason for that is because one of the things that we found over time is that one of the characteristics that most differentiates community power groups that are more powerful over time than others are ones that are constantly in this learning mode. And so that's a place where researchers have an important role to play, in constantly cultivating and developing and supporting that learning amongst our partners. And so I'll just conclude by sort of putting out kind of 3 lessons that I feel like we have learned over time in the work that we've been doing in terms of how we support community power groups. Just because, we're building these kind of partnerships between researchers and community power groups, being good allies to the work that they're doing is not always easy. And so I think that we've had to really iterate over time to learn how we can best do that. So the first lesson is this idea that we really want to focus on shared learning. And so what that means is that I think often when people think about doing research, it almost feels like the researcher gets to come in to the relationship and then control the interaction, right? We set up a research design. Sometimes people might randomize subjects into treatment and control arms. I mean, there's a variety of different things where really the control over the program sits with the researcher. And I think that's something that's very complicated for organizations that are working in dynamic power environments in the field. And so part of what we've worked really hard to do is think about how can we simultaneously do work that meets the highest standards of academic rigor so that we are supporting the development of knowledge and learning, but also co-creating that so that the control is sort of shared across the entire partnership so that the power groups themselves are able to take as much and learn as much from the work as the research community might be. And so a big part of that is this notion that expertise just doesn't flow in one direction, but that it flows in both directions, and trying to think about how we create those kind of partnerships. The second is that as we do the work, I don't know that if there's any way to do it other than putting questions of power, race, and inequality at the center of the work that we do. And the primary reason for that is that we worked with a number of different groups over the years, and they're all different and they're all unique in their own way. But one thing that is very common to all of them is that they're all working in very uncertain dynamic contexts. Right? There's a reason why these groups have historically struggled to build power within the political system. And so one of the big challenges that we have is trying to understand as they're constantly navigating these uncertain contexts, then how can we help support the work that they're doing? And how do we help keep our eye on the ball about power, about race, and about inequality? And without centering those questions at the outset, it's really easy for the projects and the work to move in tactical directions that aren't necessarily that fruitful at the end. And then third and finally is this idea. I have a quote here from a Jewish theologian who writes that, hope is belief in the plausibility of the possible and not the necessity of the probable. And I think about that all the time, just because, if you look at the data, for example, on social change and the role of community power in making social change, right? The data is that the, overwhelming response to any change effort in American politics, and that has to do not only with community power groups, but any kind of effort that's trying to make social change, is stasis, right? Status quo is the most likely outcome whenever people try to make change. And so what that means is that as we think about how we do learning and how we support these groups, we have to move out of the realm of of thinking only what's possible into thinking also about what's probable. How do we help these groups imagine a different kind of future and then make that kind of future a reality? And what role does research and learning play in helping to both cultivate and sustain that imagination, but then also substantiate it through the kind of learning partnerships that we can build? So I'll just pause there. I'm excited for the conversation and thankful for the opportunity to share these ideas with you all.